Uh, Hello everyone, my name is Dr. Mohammed Naseer. I am a consultant medical and haemato-oncologist in HCG Hospital, Bangalore. Today here I am here to talk about what is blood cancer and what are the different types of blood cancer. Blood cancer means blood of the person. There are cells called as WBCs, whole blood cells. So WBCs increase in number. They are usually about 10,000 in a general population. If it increases more than 10,000, and if those are abnormal cells, like if it goes to more than 50,000 or 1 lakh, and if the cells are considered to be abnormal cells, then we call it as blood cancer. It usually starts in the bone marrow of a person. Bone marrow means it is present in the center part of the bone where the cells are actually produced. It is actually called the blood production factory. So abnormality happens in this region, and from there the abnormal cells are produced and they come and circulate in the blood. So this is how a blood cancer actually develops. Okay, so what are the types of blood cancer we know? It depends on how quickly the blood cancer has developed. If the blood cancer has developed in a short duration of time, like within less than 3 months, we call it as acute. Acute means it has started developing within a short duration of span. And another blood cancer is called as chronic. Chronic means it has been there for a very long duration of time. So if it is present for more than 3 to 6 months, we consider usually a chronic blood cancer. So how do we know about whether it is an acute or chronic blood cancer? Like I told you before, bone marrow of the person has to be tested. Once it is tested, if we find the cells more than 20% abnormal cells in the bone marrow, then we generally consider it as acute. And if it is about between 5 to 20%, it is called as chronic, depending on the percentage of the cells. So this is how we come to know it is whether acute and chronic blood cancer. So on the basis of this, I can tell you that the most common blood cancers we see is ALL, acute lymphoblastic leukemia, CML, chronic myeloproliferative or chronic myeloid leukemia. There is something called as MDS, myelodysplastic syndrome. The last one is here there is very subtle changes which happen in the bone marrow, and these are also reflected in the blood. They are also present for a very long duration of time. Acute lymphoblastic leukemia, it is generally seen in younger age group, especially in children, especially under the age of 5 years. And with respect to this diagnosis, treatment they respond very well. Children, they do very well with acute lymphoblastic leukemia with available treatment options. Whereas in adults, the incidence of acute lymphoblastic leukemia is very less, and generally the response to the treatment is not as good as in children. Whereas in children, we can achieve a complete 100% cure rate. Whereas in adults also, we can achieve 100% cure rate, but the percentage of them achieving 100% cure rate is relatively less compared to that of children. There is another entity called as acute myeloid leukemia. In myeloid leukemia, the behavior of the cells is very aggressive. So since it is an aggressive disease, even if it occurs in children or in adults, the response to the treatment is not that very good, and they generally don't do very well. And for the treatment of myelodysplastic syndrome, we have certain medications which control this disease for a very long duration of time. And talking about treatment of leukemias, we have many treatment options. One is called as chemotherapy. Chemotherapy means the injection is given through an IV cannula, for which the patient has to come on regular frequent intervals, once in every week or once in every 2 weeks, depending on what type of blood cancer it is. So chemotherapy is administered through an IV cannula and is generally given over a period of 1 to 4 hours, depending on how many drugs are used. Chemotherapy generally causes generalized weakness to the patients, like generalized general weakness. They can be sometimes loose motions, they can be sometimes mouth ulcers, and there can be sometimes hair fall. These are the general side effects which we see with chemotherapy. And along with chemotherapy, we have something called as targeted therapy. So these are being used particularly recently in the management of blood cancer. The targeted therapy means it is self-explanatory. It says that it goes and acts exactly on the abnormal cells. So there are multiple targets which are found depending on what type of blood cancer it is, and these target cells go and attack those abnormal cells and reduce it. The difference between targeted therapy and chemotherapy is that targeted therapy acts only on the abnormal cells, whereas chemotherapy acts on both normal and abnormal cells. That's the reason why we have more side effects with chemotherapy, less with targeted therapy. So this is about the basic introduction to the blood cancer, and what are the types of blood cancer, and what are the general treatment options available for blood cancer.